So what we believe is that the government cannot have it both ways. You cannot promise healthcare and then fail to deliver it in a timely manner, and at the same time make it unlawful for an individual to take care of their own health.
Fundamentally, what this trial is about is allowing the most privileged people, the most wealthy people, to pay their way to the front of the line in healthcare. And this fundamentally undermines the principle of care based on need, not on ability to pay.
Closing arguments are being heard in the BC Supreme Court today in a case involving the main tenet of Canada's healthcare system. A Vancouver doctor launched the challenge a decade ago. He says patients should have the right to pay for private healthcare treatment if the public system leaves them waiting too long. Other countries like Switzerland, Germany, and England offer a mix of public-private healthcare. So should Canada follow suit, or would that create a two-tier rich-poor model? Colleen Flood is the University Research Chair and Director of the Centre for Health, Law, Policy and Ethics at the University of Ottawa. She's also the co-author of an upcoming book called Is Two-Tier Healthcare the Future? Hi, Professor Flood. Nice to see you again.
Nice to see you too. Thank you for having me.
Thanks for coming in. Let's start off with the basics of this case. What should we understand about what this is all about?
So this is a challenge under the Charter of Rights and Freedoms to a bunch of different laws that the province of BC has to try to protect public Medicare from privatisation. And the important thing to know is that these are laws that exist in most of the other provinces as well. So if the private clinic is successful in overturning these laws, then it may well quite quickly apply across the country. And so quite quickly we would see probably a very different system from the one that we have now. And
I do want to ask you about sort of the wider implications of it in a second, but just on the merits of the case itself, and I know obviously that will be determined by the courts, but what is the genesis of asking for this system? I mean, my understanding is it's wait times essentially, right?
Well, the claim is grounded in wait times, so long waiting, basically jeopardising a right, arguably, to Section 7 of the Charter to security of the person. So, as you know, waiting a long time for care can be, even if the result is not going to change the outcome, can be really destabilising for somebody. So that's the basics of the claim. And the argument is, look, you know, governments haven't provided good enough health care, timely health care, so they just have to get out of the way and let people access the market, and that's they're claiming that as a charter right.
And what is the decision then based on? Is it whether or not that infringes the
So the argument is that the law is in the way of that. So in this case, the two laws that the private clinic that's bringing this challenge are claiming is a law that stops the sale of private health insurance for hospital and physician services. And then another law, and probably more important, is the one that bans dual practice. So that's where a physician works both in the public system and bills the government, and then also can bill the patient for their services. So they can bill both publicly for medically necessary services and also privately at the same time. So currently the system is that you have to pick your horse. If you're a physician, you have to be either public or private. You can opt out and go private. But most physicians don't want to because they make most of their money in the public system. So the argument here is you've got to let doctors have both so that you can have a bigger private tier. That's exactly what they're claiming.
And the theory seems to be that if you have that bigger private tier, that in fact the public system will work better because people who can pay will pay for something like an MRI, let's say, and therefore the wait time for the rest of the public will decrease for that MRI. What is your interpretation of whether or not that may in fact be the case?
Well, that's often kind of a common sense argument sort of put forward why two tiers is probably not a bad idea. But the trouble is, and you've probably experienced this, there's already a shortage of many healthcare professionals. So hard for many people to get a family doctor even, let alone to see a specialist. And so if we shift a whole lot of time of specialists to a private tier, and a lot of it as opposed to just a small amount, then it's not like there are any more physicians that are left to work in the public tier. And the demand will grow in the private tier. So what we call perhaps the more worried well, or people that aren't of as high acuity, will access the private system. So doctors will be very busy doing stuff, but not necessarily the most important stuff. So basically we have a limited resource, which is the number of nurses and physicians that we have that can only work so many hours a day and so many days of the week. And if we shift a whole bunch of their time from the public system to the private system, there's going to be less left in the public system.
So we know that some provinces have already made the decision to implement some form of private healthcare where, let's say, that example of MRIs is concerned.
Yeah.
If this were to go to the Supreme Court, would a decision be able to impact the decisions those provinces can make, or provinces just sort of within their own jurisdiction can make?
Yes, so similar laws, if Dr. Day and the private clinic are successful in overturning these laws, then similar laws in other provinces will also be tested. And so, litigation will be brought presumably by those seeking to privatise the system, and the claim will be made that the precedent of Canby should apply in Saskatchewan, Ontario, wherever, and that the laws should be similarly knocked down. And then, the question is what will happen, and it's not a one-step dance. The other partner in the dance is the government. So if the court overturns these laws, then the government, both in British Columbia and at the federal level, will have to reply. And so perhaps if they're more desirous of privatisation, they will say, well, let it rip, we'll just let these laws fall as they wish, and we will allow a big second tier to develop across Canada. Or they could try to respond by saying, okay, what we need to do now is actually rescue the public system, fix wait times, and then there will be no claim to make, and those laws can stand.
On the idea, though, of fixing wait times, because that's kind of at the heart of all of this, and I think for so many people watching, so many of us have been in that system with a loved one, and wait times are a real thing, right?
Yeah,
and I think frustration with them is also a very real thing. How do you think governments have done in addressing that issue?
Poorly. But we have seen examples across the country where we've done really well. I think partly it's, you go to see your GP sees something worrisome, they call up, they say, well, I'll recommend you to X specialist who they happen to know in their Rolodex, right? And you hope that their secretary calls the secretary of the specialist. You wait patiently. You don't know that, in fact, the neighbouring specialist or even one half an hour drive away has had a cancellation. So there's no mechanism for actually moving past this kind of cottage industry that we have run. And when we have done that, where we've actually said we're not going to do that, we're going to have a central sort of triaging mechanism. We have, for example, for cardiac care in Ontario, we've got rid of those wait times. So it isn't actually that difficult to do. It is possible to get rid of the wait times without huge investment of resources. But the trouble is, on the one side, the folks who support public Medicare and doctors and nurses, they always claim that the only way to fix wait times is to put more resources into the system. I think we've tried that and it hasn't changed. So if we put more resources into the system and we just end up paying doctors and nurses more money to do the same thing, we're not changing anything. So we have to actually change this whole arrangement whereby we don't allow this kind of cottage industry to be happening where it's basically run by physicians who get seen where and when and how. And we need to have some sort of mechanisms for making sure that people don't fall through the gaps and that depending on their acuity, they're treated in a timely way. And when we do that, we get rid of the wait times. And I think it's possible to do, and we should do it.
I have to leave it there. Thank you, Professor Flood. Pleasure to have you back.
Lovely to see you. Thank you for having me.
Colleen Flood, Director of the Centre for Health, Law, Policy and Ethics at the University of Ottawa. Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.